Hello everyone, I am very pleased to be here today for the first International AL Amyloidosis meeting for doctors and patients here at home in Brussels. I'm a hematologist in Institut Jules Bordet, and I will talk to you today about the importance of vaccination and infection prevention. So first, I will remind you what is an infection, why does it matter so much in amyloidosis patients, what are those infections that we feared so much, and of course, how to prevent them. So, what is an infection? As you all know, an infection occurs when germs enter the body and multiply, causing disease and illness. There are different kinds of pathogens that will cause different type of sickness and disease. There is viruses, bacteria, fungus, and parasites. And you know that normally the body responds by increasing and activating white blood cells, specialized in fighting infection and releasing antibodies to kill those germs. And why it's important in AL amyloidosis? As you all know, in AL amyloidosis, a certain white blood cells becomes abnormal, plasma cell that normally produce the antibodies. These cells, like I said, lost its control, became abnormal. And these abnormal cells, these clonal cells, produce continuously large quantities of monoclonal and abnormal antibodies, and so produce less good immunoglobulin. It's what we call antibodies. And that creates a susceptibility to infection that we called hypoglobulinemia. And you know that our treatments become better and better, but clearly these treatments will further increase this weakness of the immune systems and create a greater risk of infection. This therapy include proteasome inhibitors like bortezomib, monoclonal antibodies like daratumumab, steroids, stem cell transplants, and of course some newer treatments, immunotherapy that we will use in the future, like bispecific antibodies and one day the CAR T cells. So what are those infections that are clearly more important in our patients? We know that some infections are more common and more severe in patients with a weaker immune system. And patients with amyloidosis are more vulnerable to certain type of infection, like respiratory infection, viral or bacterial, staphylococcus infection by a bacteria that we call Escherichia coli or E. coli, and a lot of viral infection like the reactivation of the virus that causes shingles. First, I would like to talk to you about pneumococcal disease that is caused by a bacteria that we called Streptococcus pneumoniae or pneumococcus, that can be divided in two types: invasive pneumococcal disease that is less frequent but more severe and can give meningitis, sepsis, and non-invasive disease that are a lot more frequent with pneumonia, sinusitis, and otitis, and so on. Pneumonia is the most common clinical presentation of this infection in adults, with more than 100,000 hospitalizations in the US in 2017. And of course, being older than 75, having chronic health conditions like diabetes, heart disease, respiratory disease, and a weaker immune system will be a factor of greater risk of this infection. Shingles, that is caused by the reactivation of a virus that is called herpes virus, that also causes chickenpox at younger age, with the main symptom. The main symptom is pain, followed by a rash in some area of the body, and sometimes it can become complicated by fever, hepatitis, and encephalitis. Shingles can happen at any age, but clearly the severity will increase with age and, once again, the lack of immunity. Influenza virus, it's what we call the flu. It's a contagious respiratory illness that is caused by the influenza virus, like I told you, that can infect the nose, the throat, the lungs. Symptoms include a lot of varied symptoms: fever, cough, sore throat, muscle aches, and headaches, and so on. And unfortunately, once again, being older, having chronic condition, and the weaker immune system will be a risk factor for developing serious complication of the flu. Of course, we all became very aware these last few years of this new virus, COVID-19, that is called by a virus that we call SARS-CoV, to make it short, that give flu-like symptoms with a very increased risk of severe respiratory complication. As you see, as of the year of 2020, there were more than 700 million cases confirmed, with more than 6 million deaths reported by the WHO. And once again, being older, chronic condition, weaker immune system was a risk factor for developing this serious complication. So now, how can we prevent them? There are different measures that we can use. Some are very simple. First, we can use prophylactic treatment that we propose in all patients that is under treatment. We have some prevention against this herpes zoster virus that is acyclovir or valacyclovir, depending on your country. And it's especially important in patients treated with bortezomib or daratumumab. Pneumocystis, I didn't talk to you about this complication. It's caused by a fungus that can cause respiratory issues in patients with a weaker immune system. And there is especially a greater risk in patients with treated by high-dose cortisone, who have what we call lymphopenia, a rate of lymphocytes less than 200. Patients who went on the autologous transplantation, and of course people who already had this infection. What can we use? Our first choice is cotrimoxazole, Bactrim, Uzaprim, and second option possible like Atovaquone and Pentacarinate. The use of antibacterial is cause of great debate, and its use depends on centers. I know that my colleagues in France sometimes use antibacterial like amoxicillin or penicillin-derived antibiotics. We don't use it in Belgium. I think it can be considered in patients with a higher risk of infection, but why do we not use it to everybody? We fear the risk of resistance by using chronic antibiotics, so case by case. Of course, some patients will have immunoglobulin. Like I told you, the disease or treatment will cause hypoglobulinemia. So what we can do in patients having frequent infection or severe infection, we can increase this rate of IgG, immunoglobulin, by giving them IV or subcute once a month or a week, depending on the form. Vaccination is another measure that we can use. Clearly, vaccination is one of the most successful medical interventions that has saved millions of lives from now. It's particularly important in patients with amyloidosis, who have an increased risk of infection. Ideally, vaccination has to be proposed at early stage of the disease, ideally when you have what we call monoclonal gammopathy or MGUS, or smoldering multiple myeloma, or before the initiation of the treatment, if it can be done. It's important to use inactivated vaccines. What are these vaccines that we will talk to you in consult? I'll talk about the risk of the infection by pneumococcus. We have a very effective vaccines that lessen the risk of severe infection. Two ways. There is a newer form that protects you against 20 strains of this bacteria. It was called Prevnar 20 or Apexnar, or we can do the older way, if I can say, by using first vaccine that protects against 13 strains, followed by a larger vaccine, Pneumovax 23, that has to be repeated every 5 years. There is no vaccines against herpes zoster virus, donc that reduce the risk of shingles, that is now reimbursed in Belgium, for example. You have to do 2 doses at an interval of 1 or 2 months, and it has shown to reduce greatly the risk of shingles. Obviously, you are all very familiar with the vaccine against the flu. Its recommendation is well known. At the beginning, initially, recommended to do 2 doses at 1 or 2 months apart, and after that, it has to be repeated annually, usually around the fall, and will contain the more recent strain that was present the years before that. COVID-19 is a newer vaccine that we have since a couple of years that has shown to reduce the risk of severe infection. It is recommended by the CDC to be that patients who are not vaccinated yet should have at least 2 or 3 doses of the same brand. And for patients who are already vaccinated, the latest recommendation are to have the update 2024-2025 at the fall, repeated, and there will be updated vaccines that will be available this fall. Of course, it's important to vaccine yourself when you are especially when you are treated. It's also important to protect yourself. That the people around you should also be vaccinated. That concern the healthcare people, but also the family members. It is recommended that patients in close contact with patients should be vaccinated against influenza and COVID, no matter the age, and people older than 75 should be vaccinated against pneumococcus. Of course, the immunity against the spectrum of pathogen that we got vaccinated against during childhood should be vaccinated. That's the case for the mumps, rubella, measles, and whooping cough. Of course, there is a lot of simple measures that we can all do. This picture was very advertised during the COVID period. Obviously, some of them are we are a bit less strict about that, but of course it's good to air out the room. Important to have the mask when you are in closed space, especially when you are doing treatment. Wash your hands and so on. It was very important at this time. I think in some cases we have to remind this simple measure that we can do. So in conclusion, AL amyloidosis leads to the reduction of the production of functional antibodies. It's what we call hypoglobulinemia, and our treatment will further suppress the immune system. So some infection will be more common and more severe in these people. That's why different measures exist to prevent those risks. Prophylactic treatment, vaccination, and simple additional measures. And with that, I thank you for your attention.